University of Odisha, then MUHS, and he's an internal also from Self University, that is University of Guwahati. Sir has also completed a certificate course in Psychiatric Council by City Health Association, Kolkata, and certificate course in Yoga Therapy by Government of Assam. There are many publications. To be noted are the two textbooks, which one of them is very recently Sir has launched, Practical Manual of Rachna Sarir, which was lacking till now. And there are 16 articles which are indexed articles. Sir has attended many seminars, also given lectures there, and have attended some workshops also, CMEs, like nearly 10 CMEs Sir has attended and given his lecture of the knowledge also. I will name the names of the text actually, the comprehensive text of Sarir Rachna Vigyan and Practical Marma, Manual of Rachna Sarir for BMS, which is very recent book. Sir has been a very frequent learner also, what I can say, that in after so much of experience of 20 years and 10 years of teaching experience in PG, Sir has recently, or I can say 2-3 years back, Sir has started a Marma OPD also in his hospital after many difficulties, what I've learned from him. And a very unique type of concept Sir has developed in his OPD. Sir is giving all the things which are related with the health and pranic healing, what I can say, what I can understand from that part. And I think everybody will be immense help with his knowledge that what he is going to say today. And Sir is going to give practical knowledge. This is more important because what I have understand from Marma, that everybody says Marm is going to do this, Marm is going to do that, but how it is going to do, this is still a question. So I think today's lecture will be one of the lightning lecture in this field. And over to you, sir. Now that's all from my side. Thank you for giving me opportunity. Tikin, sir.
Respected Shukla sir, respected Rakesh Sharma sir, Sushin Khatekar sir, Sharma sir, all the faculties present from different colleges, doctors, UG and PG students, and their Gaurav. So for me, it's a privilege to get an opportunity to share a beautiful science, which is an unfold story, that is their Marma Chikitsa in the aspect of their treatment. As Gaurav says, yeah, it developed or the study has carried out last 4 years. So whatever the knowledge that we have attained from my different teachers, from different faculties, and that the only clinical subject along with their clinical result, whatever I have got, that we want to subject or we want to submit in relation with our presentation. So before starting it, remembering Lord Shiva, Om Trayambakam Jajamahe, Sugandhim Pushtivardhanam, Urvarukamiva Bandhanat, Mritturmukshayamamritam. May Lord Shiva give each and everywhere moksha or their eternal peace. Before starting, 1 or 2 lines regarding our Marma. What exactly we want to know regarding the Marma? That the morality Marma is that our little aspect or the little study, whether that's the sufficient or it has to some other aspect or it has to some other broad aspect has to speak. With this, I want to start my presentation. So now that's my actually point of to speak. That is Marma Chikitsa and alpha healing technique. Lord Dhanantori, we almost praying to him. We'll start now. The Mormo science. As I say, the Mormo science is a treasure of Ayurveda, representing our vital energy where prana circulates. So prana, understood as the life energy, where is derailment, influences pain, disability, loss of sensation, or in death. Hence, injury to this seat or the or mormo area, rather to say, causes morbidity or mortality. Little aspect of the mormo, that is our mormo with deluxionus, has emphasized including some. Here we have completed a MD study where we have seen our mormo in relation with our sports injury. Basically, we try to see in relation with our Gulfa mormo in the aspect of their football. So that is a little part that we have carried out in 2018. But in later part, as I said, whether only the little part it has to spoke or the therapeutic aspect also has to be addressed. Recent researchers have used mormo stimulation with therapeutic approach shows the encouraging outcome. So therapeutic application of this vital area triggers correction of pathway irrespective of structural or cellular damage. That my point of question when in our 2014 or 2015, when everybody says that the mormo causes the structural injury. From my point of view, if you cause something structural injury, obviously there should be our cellular injury too. Now the question is arises, the main question, can the Mormo Chikitsa has got any references as Mormo better to understand in relation with our site of prana? So hence the pranayatana that mentioned by our Acharya Saurabh or our other different aspect of the prana also should be stressed. Here it is a very interesting thing that in Mormo science and treatment procedure has observed in ancient literature like our Vasishtha Samhita, which we very rarely used. When I started in my earlier part, that is in 2021, at that time we have seen it, whether it has got some relation. So at that time we have seen that the Pritaharang Prasamsante Chanjuta Juganisada Astadasa Juga Parma Sthane Sudharanam Sthanat Samakrita Pritaharang Sasotas. All you know, Yam Nyam Asan Pranayam Pratyahara, the fifth stage. Now, in relation with the Vasishtha Samhita, it is said that there are different number of this site and the pratyahara or our withdrawal should be done according to this. The same concept is again highlighted in our Sandila Upanishad, where you can see the 18th sthan. So where and the concentrating on the 18th sthan in our ascending or the descending order is beneficial for our pratyahara. That means in the yogic science, it is said that the mormo has to be treated, or our mormo has got an applied part. Before that, again, there are some another concept that mentioned in our mormo therapy in our Tamil Nadu, or this is also has got the similarity or our other different studies. So now what is exactly I want to spoke? So prana govern all physical and subtle processes of our living being. Here, most stimulation of this mormo is the most direct method of our harmonizing the prana. Here, this should be understood. Acharya Saurabh says, Ahimsa praninam prana vardhanam utkrishtatamam. That means for the enhancement of our life energy, ahimsa is our best. However, in clinical aspect, it is to some extent difficult. And rather to say, if we have to use our mormo area, which is also the side house or which is also the house of the prana, we can use as a direct method for harmonizing our prana. Now, can we proceed? So for that purpose, the mormo chikitsa can be classified in two ways. One is in relation with our non-pharmacological intervention, where I want to speak it, and another portion is our pharmacological intervention. That means once without medicine, जिसको हम लोग अद्रव्य चिकित्सा बोलता हूँ. Another one is our द्रव्य चिकित्सा. Now, how can the mormo here has to be incorporated? Here, it is said that the mormo is a site where our life energy has to be involved, and the prana may be related into all the different kind of our therapy. Prana can be related along, or prana has to be activated. I repeat the line: the prana has to be activated along with the either non-pharmacological intervention or by our pharmacological intervention, which we can group in this way. If we say the non-pharmacological intervention without medicine, the meditation and meditation and mantra, pressure of our mormo area, Yugasana, pranayama. But apart from this, there are some other courses, or there are some other method of their healing their human body. The pranic healing, acupressure, as well as the acupuncture, also has got the same aspect of the enhancement of their life energy. Now, which medicine, what are the other different procedures of their life energy or the prana can be enhanced? It is defined as the Abhyanga, Alapa, Utpartana, Aruma, so magnetic therapy, as well as our Kala therapy and the Atribhavasti. Next, now, how we apply it? So that is my aspect. So therapeutic approach of our mormo, it can be classified into two ways. All we know there is our 107 number of our mormo, as mentioned by our ancestors, as Susutas. Then we can classify it into our external and internal. Now again, it can be from the therapeutic aspect. It can be classified into two ways. One is our vulnerable point. Next one is our less vulnerable. Now external, these are presently most on their extremities and back, including Amsa, Amsapalaka, Utti, as well as Staponi, Utsepo, Apanga, Simanta, Odhipoti, Krikatiga. On the other hand, the internal mormo, or the mormo that present in their interiorly, which is our difficult for our touch, these are our Nila, Munna, Matrika, as well as our Hidaya. So again, as all we know, as all are our learned scholars are here, so Saddha Pranama or a mormo, obviously it will be our vulnerable, which may include our Sringataka, Matrika, and Hidaya. These are only example. On the other hand, some less vulnerable, the mormo that present in our limb as well as our back. Now, this look that taught in our BMS level, and everybody has to be, or almost everybody has remembered this look. And this is one kind of our base of treatment. Mormani mamsasni sirasna sannipata tesu sabhaveto ebang visesana. Visabhaveto sabhavata ebang visesana prana tistant. Now, Susuta further says that not only this particular aspect, some other aspect is also there where the mormo can be addressed. These are Sumo, Maruta, Teja, Raja, Satta, Toma, and Bhutatma. Now this is important. Now this is in concept of our data. I am again saying that this presentation is exclusively based on our clinical interpretation and mostly in relation with our prana. Hence, a little bit explanation of the prana given by our Asatya Sutta. He mentioned regarding the Agni Sumo Vayu Satta Rajaktama Panchendriyani Bhut Atmani Pranaha. So these are our 12th number of our prana. Now, if life energy get radiate, this is if life energy get radiate from each and every living being, when I search in our different other study apart from the Ayurveda, whether another science has to speak something or not. It is very essential, very interesting that there is certain study where it says that the energy get radiate from each and every living being, and it can be assessed by, I am mentioning here that Kirilian photograph. Actually, Kirilian is the scientist. I think yes, it is. He is in the 1939. He is a Soviet scientist. He somehow or accidentally he invented this kind of or electric kind of the energy that get radiated from each and every structure. So it is seen that the energy get radiate from each and every living being. That what we what we termed it is as our prana. So now, before coming the previous slide, so same thing. So it is one kind of our modern entity which gives me much more important, which give me much more encouraging. We can go along with our study. Now, as all of you know, how we have to select our mormo. Again, I am saying here, not only our aim only to identify the site, we have also important how we has to advise this patient to touch that particular mormo. Supposing, as Sister says, grow modde. So the meeting point that we know as our glabella, we can define. Apango, Rupus Santara, that we want to see. So if our Sangha, next, Utsepa. This is our Sangha. So this is our Sangha Upori. Next one is our aborto. Upori, Nimro aborto. So this is a point. You can see this scholar or the doctor here try to give the pressure in the junctions of our medial 1/3 as well as our lateral 1/3. That is the area we are giving the pressure above. We are giving the pressure above as well as posteriorly. I will say you in later slide also. So these are Simanta, Pancha, Sandhi, Sirasa, Vibhakta. Now this is our Odipati mormo remains in our interiorly. This is remains in the interiorly. It is very difficult to touch from our exteriorly. I only show it. This may be an area. Odipati is our highest point. It may be only an area which we normally in anatomy define as the highest point of this skull or our vertex. Now, relation. Now, if we say our Sira Sandhi Sannipato Ruma Barto, if we see this line, Sira Sandhi Sannipato Ruma Barto, if we see this terminology, then there is the Sira Sandhi Sannipato, then it indicates as they are confluences of the sinuses that present in our interior aspect of our occipital bone. Now, these are Krikatika. Now, where we are giving the pressure, you can see exactly our Sirogriva Sandhane. This is one of our doctor. So where we try to see exactly giving the pressure between our head as well as our neck, then we try to give the pressure with the help of our thumb finger. Now this is Amsa. Now what happened? All this kind of our pressure point that we are giving the pressure here. This pressure has given during the time of our exhalation. Next. So this is our Amsa Falaka. Here the volunteer is asked to touch the maximum by the opposite side. That particular opposite side we are considering as our Amsa Falaka. Next. So this is Urbi, Ani, as some clinical study is there. So I will say you. So now our Purpara, Hasta Baho Sandhane. So here we try to give indeed our two different aspects. Two different aspect means here we try to giving the aspect in both the aspect, either from their medial side or from our lateral side, placing our thumb as well as the middle finger in the line of our elbow crease. Now, the most important, and I think that is the most astonishing kind of the mormon that I got in the whole our 120 number of the patient study is the most astonishing. The learned scholar obviously can share their view regarding this. So here what we do, below we have got we will say in what are the diseases as well as what kind of the mormo we have selected. But this is our Indrapasti mormo. We have got the explicit kind of the result. Here we try to put the forefinger below our elbow crease. There is a line we have drawn. Then we try to give the pressure. Now this is in relation with our hand. Now in relation with the leg, we are also doing. in relation with the leg we are also doing. And it is very interesting, if we do any kind of their cervical pain, I personally say that the pain get subside. Yes. Next. Now this is Monibandha. Next. Okay, so this is another one. That is our important mormo. Chipressa uparistat avoyata pursha nama. Here one thing I have to confess that some mormo we are using in lately. As I am saying, this study is exclusively, that is the data presentation is based on the our 4-year, from the last 20 up to the our 24-year. So this 4-year, whatever the knowledge I have achieved, then we are sharing it. So this is the our due to some technical difficulty I have used recently. There is the our Pursha mormo. Here you see the forefinger. Forefinger is the our total dimension, and the accordingly the pressure is given along with our arrow mark. Both it is given by their thumb as well as the index as well as by our arrow mark. Still, if we do not give the pressure by our arrow mark, then there is no question of the touching of the our Pursha mormo, or it get the benefits. Next. Next, the Pursha Shira. Obviously, it is our head of the our Pursha. That is, it remains will be our above the Pursha. So it is the dimension is our ek angula. Okay, so now this is our Parsha Sandhi. We have got a nice presentation regarding low back pain. At that time, I am showing much more clearly regarding this is our Parsha Sandhi. Okay, so now poti got it. Okay, so now in Parsha Sandhi, where we are giving the pressure, we try to give the pressure into our costovertebral angle or our renal angle. We exactly try to put our pressure with the help of our thumb in our costovertebral angle or our renal angle. So now this is another. So Pishtabamsa Uhayata. Now this is the region actually. The finger should go to the right finger should go to some extent below. Here we try to give the pressure in our sacroiliac joint. We try to give the pressure in our sacroiliac joint. Kipra, it is mentioned in the classic that two mormos should be emphasized maximum. One is our Kipra, another one is our Talo Hridaya. Angusta Anguli Madde. So nicely it is said that the Angusta Anguli Madde, the Kipra morma are present. It is Snayu morma. Here the pressure should be given from our above to the below. Some can give the pressure from the upward to the downward, but in my cases I have seen that when they give pressures from the above to the below, then we have get our much more result. So this is our Talohridaya morma. Actually, this Talohridaya morma location we have postulated in very much my thesis in our 2018. When you see our little aspect, then we try to see in Dr. Jayantijit Mohan. We have studied that. You can see we have seen that our there is slopes also. But I would think that this can be the easiest way. That is our Talohridaya. If we say that is center of our palmar, center portion of our palm, if we touch by our thumb finger, then this is our area for our Talohridaya morma. Again, one of my students. So it is defined as their stona mula. Here the pressure is given from our below to the above during the time of our expiration. Now this is our Hridaya morma. Actually, I do not touch the heart. Again, to be honestly to say, though there are different kind of study we have got recently, but still I am not giving the exact amount of the pressure in our Hridaya morma. Placing the heart in the mechanism, the placing is okay, but I am not giving the pressure here. Here we try to make our fist as well as the thumb should be directed upward, and then our right hand should give the pressure. Then the left hand should give the pressures on our right arm. Then during the time of the exhalation, the pressure should be given in a homogeneously. Parsha Sandhi repeat. So now Prihoti is easy. Prihoti is very easy for our forefinger below our Angsha Falaka. and return. This is the our Kukundara. Ask the patient to sit in the our Vajrasana. Ask the patient to sit in the our Vajrasana. Then close the our two different. Then close the our two different. That is the our both toe. Then try to touch. Then ask the patient to touch the buttock through the our heel. Exactly that area which is defined as the our Kukundara. All we know is the Kukundara sti or this is the our Kukundara Marma. Now, this is there is two aspects of the study. Some wants to say that the Janu should be give pressures from the anteriorly, and some wants to say the our posteriorly. I am showing the both the anterior as the our posterior aspect. However, in my clinical study, we are doing the our anterior aspect. Here we try to see both the palm or the ridge of the our palm, try to touch the our both the our menisci. Our aim is to try to touch the our both the menisci. Menisci is not a possible to touch, yet our aim has to give in the our pressures in the anteriorly. So that's our aim. That is from the anterior aspect we are giving. So this is our posterior. Now this is another aspect of the vulva. Pada Janghaya Sandhana. There is the our part between the our you can say foot as well as the our leg, where the our we are giving the pressure, making a 90 degree with the our both malleolus, lateral and medial. Now, the mechanism of stimulation. I will again repeat this line in latter part. Mechanism of stimulation. Question is, stimulation and irritation are two different parts. Here, we try to give a moderate amount of the pressure. The area is stimulated with the palm of thumb. हम लोग क्या करते हैं? We take the our thumb. Sometimes we are taking the our side, and sometimes we are taking the tip of the finger applied over the selected Marma area, and after that measuring the dimension by the unguli of the patient concerned. Sometimes palm of some according to the patient concerned we are giving the pressure. Sometimes, so this is the our palm of the clinician is also used as like in Navi Marma. This is we have got very prominent results, specifically in relation with the constipation. Two aspects. One is our Pavan Muktasan. Next one is our giving pressure into the our Navi Marma. Navi Marma. It seems that it can be given along with the hot water and these things. I think this much is sufficient to cure the persons of the our that is in relation to constipation, and even the IBS. We have getting some very good results. Now the question is arises. Unguli, all I know, there is our unguli, there is our person concerned. Regarding that, we have published a paper. That is our standardization of our unguli praman. To whom we can consider our unguli? Should we say the distance that remains in our ventral aspect, or should we say that distance that remains in our dorsal aspect? Here we are taking distance between our medial border of our metacarpophalangeal joint of our index finger up to the lateral border of the metacarpophalangeal joints of our little finger. So here we are taking our two different aspects, and both is here taking in our dorsum. So here we are taking the dorsum, but the ventral you can also take. We have taken actually three area. Then this area I found much more suitable. Next. Okay. So now this is actually that area that giving the picture when we are saying that how we stimulate, or what is the procedure exactly stimulate. At that time with this picture I am saying, here I am just simply very shortly saying that now there is it is very difficult for me to assess in how much amount of the pressure should be given, because the Marma, if we say in relation with our life energy, then it should be calculated along with our heart. Then we have to go in relation with the peristal, in relation with our systolic as well as our diastolic. So at that time it looked like that the 0.8 second it should be our sufficient. But when you go practically, and when you ask the patient to do, it is difficult. It is very difficult. Hence I take a major portion that is should be actually 16 to 18. Then again seeing that if I got our difference is there between 16 to 18. So now we are continuing is that our 10 times in a minute between the eyebrow, and the picture is already shown. That is our in between our two eyebrow. We with the help of the thumb and middle finger, we are giving the stroke. However, in certain or in some scholar or other mormotherapist, they want to do our rotating the finger over the particular area. Next is our Sangha, which we are using continuously. Put the index and the middle finger of the both hand combinedly over the temporal region of both sides, and then rotate both finger for 10 times in a minute. Now this rotation according to the direction of a clock. घड़ी का काटा जिस तरफ से जाता है उसी हिसाब से अगर आपका फिंगर मूव करते हैं, then that is the area to stimulate our Sangha Mormo. And all this has done 10 times in a minute. Now Utsepo, place index fingers and middle finger just beginning of our hairline and rotate continuously for the 10 times in a minute. Same thing in relation, same thing that is in the aspect of our towards a clock or clockwise we can say. Now this is another one. That is I have got one can, if you can say, if somebody has asked which mormo you want to speak, then I will directly go for your Simanta. So it is a very interesting mormo that we are using it. That would the proxy what we try to do. We try to do there is a lotus open and lotus close. Again I say what we wants to go. We want to go to our lotus open as well as our lotus close. So for that purpose, put the proximal part of the hand near wrist just above the ear and press the scalp with palm and finger during exhalation and release during inhalation and continue it for 10 times in a minute. 10 times in a minute. In all the mormo area, we are giving the pressure during the time of exhalation while releasing our hand during the time of our inhalation. This is done so that the inner structure should not be disturbed. Now Odhipoti. So Odhipoti stroke the highest point of the skull or the vertex for 10 times in a minute. We are selecting the mormo. However, we are very little using this particular mormo, or very scanty of this use of the Odhipoti mormo. Now Krikatika, another mormo. This is we are using randomizedly. Put the thumb of both hands in a linear line at the time, because it is said that the Sirogriva Sandhana. Hence, we are putting our head or our hand in the junctions of our head and neck in the posterior aspect and give pressure. During the exhalation, the area is pressed, while inhalation it is released. Now, as you can see, the previous volunteer take her hand. So how we place our hand? Our aim is our mormotherapy not to disturb any structures or not to disturb such kind of structures which are much more vulnerable. Hence, we are making this procedure. Ask the patient to please place his or her hand between the root of neck and head of arm, making 45 degrees of their elbow. It is easy. Now give pressure over the area of the shoulder by thumb during the exhalation. Now the thumb, when it is said, it is done by our clinician. This can be also by the person concerned. When you talk the person, then the person himself or herself can do it. Only thing is there, that is our bahu madhya. That is our bahu madhya. That is our head of our arm should be first selected, and in the center between the neck as well as our head, we are giving the pressure. But that center we are selecting, making or putting the arm according to the person, because it is very essential in mormo. If it is life energy and as the person size are totally separated, my size has got totally different to our other size. Somebody's hand, because maybe it's different, and the life energy or the prana will vary according to the size concerned. Hence it is done according to the person's hand. Next is Amsaphalaka. Ask the patient to touch the inferior aspect of our scapula. We normally try to do as much the patient do. और पेशेंट को जितना वो कर सकता है वहां तक करने के लिए we advise करता हूँ. अभी जो पॉइंट उनको मिलता है, now press and release the area with thumb during exhalation and inhalation. It is done 10 times in a minute. So this is the standardized. Now Urbi, place the, so this is the, these two we are using there. That is our song, Amsa and the Amsa Falaka. We are using in a continuous way. And our Urbi, place the thumb over the middle of arm and press thumb and press 10 times in a minute during exhalation and release the inhalation. This is common. Ani, 3 finger above our elbow crease. The area is, now the area is pressed both the our medially as well as the our laterally. That means we have to give the pressure both my thumb as well as the our in both the thumb as well as the our middle finger. Our purpura, another very interesting. Purpura pressure is given at the elbow, touching both the medial and lateral epicondyle by the thumb and middle finger respectively, which is continued for the our 10 times in a minute. Now the inrobustry, as previously I am saying, this is one of the one of the most important things that we have observed in this particular clinical study. 4 finger away from the clinic elbow crease. The same will be occur in the our lower extremity. Lower extremity, it will be happen in the our in relation to the our knee, that is from their popliteal fossa. Here it happens in relation to the our cubital fossa. 4 finger away from the elbow crease in the central area of the ventral aspect of the forearm is pressed during exhalation and released during inhalation. So Muni Bandha. So this is we are doing we are doing again one more we are using continuously. This is we are doing in relation to their stress management. That is the giving the our both the stylus process we asked to give the pressure during the time of the our exhalation. Now Kipra. Now one thing should be stressed here. If we take the our right angle, you can press the area between the thumb as well as the index at any way. You can press the area. But if we make the right angle, then the pressure is, or then the pressure as well as subsequently the results are very much prominent. It is, and it is very happy for all of for me also, for me to share that the tremor can be subsided by our giving pressures in the Kipromormo as well as the our Kipromormo as well as the our Krikatika mormo. It is very interesting that we are giving pressure to the Kipro as well as the our Krikatika. Mostly we have seen in the 4 or 5 passages. So make a bend, just I'm saying. So now Hridoi Mormo, just though I am saying we are not giving the our pressure, not giving the our pressure and not doing any kind of the or clinical study we are not doing. Stonomula, yes, we are doing. One of my students has completed her work in relation with the our PFR versus the PFR versus the our in the our zugotherapy changes in the our respiratory. Along with at that time 2 or 3 cases we are trying it, Stonomula as well as our Stonovita. Now Pursa we have done above Kipramorma, give pressures on the dorsum by thumb with index finger or index of opposite hand in same horizontal line. This is important. In the same horizontal line, not only given by the thumb and index, should be given by the our horizontal pressure should be remain. Purchachiro, that is our head obviously. So give pressure by the opposite hand from medial and laterally upward. Now Parsa Sindhi already I'm saying. Otikaturuna, just giving already saying. So Gulfa. Now this is important. Ask the patient to sit in a semi-flex condition, semi-flex position. You can also rotate your position. Now give the pressures on the medial malleolus as well as the lateral malleolus. Simply things to be remembered that it is on the mormo. Stimulate during the time of the our exhalation. Now probable mode of action. Now it is very, very difficult for me to probable mode of action. Very difficult because already it is enhances as our little area. We are using it is a therapeutic area with good amount of the result in my ancestors, Zusisar or all the other different teachers has done regarding a lot of work. I only want to make it is much more specific in a very small sample size. So here from probable mode of action, there should be another third line is there, that is the our in the. So there is the energy enhancement or the pragmatic alteration of the Mohabotic and the Tidusic concept. If we see the our mormo, there is no specific mention in the our dosic aspect, but they have categorically mentioned regarding our Mohabhutic aspect. So in my presentation, what we want to publish it here, both our Tridus as well as the Trigun we want to emphasize along with our Marma. Now it is our Marma Chikitsa contribute to recharge the physical, mental, and spiritual energy in physical level. I strongly believe that our Sthula Sharir, Sukshma Sharir, both have to be activated in the aspect of our Marma Chikitsa, in the aspect of the Marma Chikitsa. It may help in activity of the tissue, while at cellular level, while vital functions of the human being like digestion, respiration, and excretion can be mentioned here. In psychological level, it enhances the mental activity, probably by the involving their higher center. Here, as I saying in my college, what we are doing in the work of the government Ayurvedic college, we are doing our spiritual enhancement by using our Om Shanti, Pranayama, and Marma Chikitsa. Here you can see we are wants to do all the method, or what is the maximum possible easiest method which we can do for enhancement of the prana. Here we are not targeting only the Marma. We are targeting our enhancement of the prana involving our Marma area. Now, yes, precaution. Obviously, we are taking extreme precaution before starting because it is very difficult. Some are agree, some are not agree. And I confess to say that this kind of the pressure point first I am sharing it. The first I have to done by in my own hand. Then I am going to do by in relation to our different aspect of the patient. So it is seen that a very moderate pressure we have seen or we have done it. It is best for the hour. So if we ask the patient to do after evacuation of the bowel, then it is good. Here you can see Odipati Marma in hypertension may be harmful. These are references I got from another study, but I am not doing the Odipati Marma here. Then whether any kind of the concept is there in our ancestors apart from our Pratek Marma Nirdesh. That's my question. Apart from the Pratek Marma Nirdesh, whether there is any other kind of the references. Here Asatya Sarabha very nicely says that there should be a person should be some kind of the characteristics where he should be defined as our prana visharabhutta. Only then, so a Marma Chikitsa or a person when we go for our treatment, then he should be or he should bear all these characteristics that mentioned by our Asarja Soraka. Next. Here, one thing again I have to share it is that so more in Marma Chikitsa, in your own energy, you have to transfer to or you have to give in to the patient concern. Hence, I want to define is a Marma Chikitsa, rather to define as a Prana Chikitsa. Here, Marma pressure, it is defined as our Marma area, where we are saying that the Kipro area, Kipro Marma, there is a Marma area. Now, meditation, we are doing our Purab as well as the rest of, but the Marma, mantra, that is our Om Shanti. You will see in my video. So these are different kind of these are different number of the patient that we have recorded in the last last 1 year. We have seen almost 119 or the 120 patient. The patient can be categorized in all these kind of the disorder. Here you can see our maximum is their cervical pain as well as the low back pain around the knee, post-menstrual tension. Now you can see it here. If we see even there are 4 headache, all 4 are related to the pain. It is very essential. Ruja, the main characteristics of our involvement of our Marma, it is categorically seen. It is categorically seen in our study. Again, if we say Asarja Saraka clearly changes that in relation to the Marma Chikitsa, the treatment for the Bayu should be done. And it is, and in our study, it is also seen is very prominently. Next. So now, this is the study that completed study that the data that whatever we are showing to you. The last that is our on the 16th, that is on the Tuesday. The total number of our 120 patient that we have recorded, we have collected our study from our 23rd April of our 23rd April of our 2023. So it is a more than 1 year and 2 month data. We have collected this much amount of this data, this much amount of the patient. Now protocol used. Now what protocol we are using? We are using that they are something for 10 into 3 minutes. Here we try to ask the person to answer to pronounce the om. Now for that purpose, we are again selecting a specific machine where where the voice is it is a one particular fix, because it is essential. When I treat the patient, when I ask the patient to pronounce the om, it is very difficult, because nobody is willing to open his or her mouth. Then along with him or her, we also pronounce our om. Then in a particular time, he or she also does it. Next, our pranayama, that just I am mentioning it. From our left nostril, we are doing it. From the left nostril, we are doing it, purak and rasa. Then the third one is our stimulation of our Marma area. Now these things is along with the Marma pressure, something followed by the purak, rasa, and pranayama are also carried out. Now, this is the things only I have to want to say that in abdominal discomfort, purak, rasa, and kapalbhati. Now these things, if we add the kapalbhati along with all these yogic method, all these our other purak and rasa, or along with our Marma Chikitsa, then the patient get very early removed, early improvement. And according to the patient, we want to continue. We want to continue this. It is very essential, and very little chances is our injury to our person concerned. So that's the things that we also say, that is our government Ayurvedic college has opened the OPD of Marma Chikitsa 8/4/2023. Till now, 120 patients has enrolled and encouraging results found after completing treatment protocol. Now, so this is one kind of actually our future scope. This is one kind of our future scope. Now the question is the most interesting question, that giving our pressure, as the pressure will be vary to the doctor, as the pressure will be vary to the doctor, and again the pressure will be vary if the person is a very lenient thing, if the person is a very you can say very well built, then what we'll do. So for that purpose, let us try. So we are approaching with IIT Guwahati, and they are very much interested. And hopefully, if everything is gone and according to your blessing, if everything goes properly, then probably in the 2 or 3 months later, we are going to develop, or rather to say, we are going to do a collaborative work in relation our IIT regarding the equal distributions of the pressure in the Marma area. Now, this is encouraging for me, or for government Ayurvedic college. This is our latest one, or our latest development. That is this is sent by our government of Assam, Ayush, that at 9/7/24, they want to include our Marma Chikitsa in the musculoskeletal disease along with our Panchakarma. So this is a project they have submitted. That is the Panchakarma as well as our Marma Chikitsa. They want to submit it. So now, as I'm just saying, the 2MD work is, so this is a very encouraging part from us that the Ayush has submitted, and it is very recent. It is on 9/7/2024, very recently. So lastly, so 2 work is going on in my department. This is our 2MD research work. One is our in relation with the cervical pain, though the topic name is very long, and our one is our in relation with our dysmenorrhea. Same thing, the enhancement of our prana. Dysmenorrhea, it is mainly asked by our PTSR department continuously. Now see, here you can see the leg. You can see the leg where the pressure has given. First, you can see a total covering or a total kind of the pressure. You can see this is basically done. They have in relation to our varicose vein. They have done in relation to our varicose vein. But when we approached, then the PhD scholar asked in relation in advice to the teacher that, sir, whether it is possible for Then we try to see that there is a chances in the equal pressure can be given into our Indravasti Marma. So that is one kind of the assumption that we are doing it. Next. So this is our lab, and this is our professor. This is our professor, and both are my scholars. She is Dr. Sirin, who is that you have seen the photograph, and she is Dr. Pooja, my first year, and myself. So this is our gate lab, which we are there regarding the in relation with our Marma Chikitsa. They have also asked me to visit that one. So now last one. Here, after completing the 120%, I have to say that life energy accelerated through yoga, especially through pranayama. It ensures flow of prana involving different mormosthana. The morphological part of the yoga asana, that is nari, chakra, definitely activated by our Marma Chikitsa. The only different kind of the nari or chakra that is taught to us, probably in my student life. Now it is now it can be said that there is definitely activation of the Marma is there. Hence, probably in later part we can speak something much more. Combined effect of the Marma Chikitsa and the yoga therapy are much more visible in the clinical perspective. Dominic. Now the question. So these are some of the questions that is actually when I start the project at that time, some question is asked by some part of the India, some part of the that is some my student is also. So now here these are very common and very small question. Whether it is possible, Marma Chikitsa is possible. Involvement of Marma observed in morbidity, obviously. Now pressure pricking. Now the pricking I am not using. This is using some other scholar or the other scientist they may use. Rotating I am using. Compressing the affected area stimulate the flow of prana. Now we are saying here the flow of prana or flow of prana definitely possible by giving the pressures in our Marma area without disturbing the site. Next question, that is their equal distributions of the pressure. That is the actual question. Marma Chikitsa is a therapy where blocking hindrance of the prana is corrected. And obviously, according to the body frame as well as the strength, as I'm already saying, both doctor pressure in Marma will vary. This is very, very important. And the mental status of that particular person who is going to give the Marma therapy, it is very much has to be taken into the consideration. Now, side effect, yes, we are giving the very moderate range of pressure, and mostly we are avoiding our Sira Marma. Mostly there is our Hriday, Nila, Munna. We are avoiding it, not doing our any kind of the pressure, and still we are not getting any kind of the complication. Now that's our precaution of the in acute condition. In acute condition of any morbidity, avoid even moderate pressure. We are avoiding even moderate pressure in our acute condition. Now so this is certain example. Sira Marma can be stimulated by yogic practice, for example, Brahmari, for Nila and Manna. Now this is one kind of hypothesis that we are trying it, but we are not using it. Next. This is the journey that I said. So I am taking now some 2 minutes or 1 minute to run the video. If it runs from my side.
Hello everyone, I'm here to introduce you our new Marma OPD under the Sharirachna department in Government Ayurvedic College and Hospital, Guwahati, Assam, which provides several facilities such as treatment for headache, migraine, cervical pain, stress, and post-menstrual tension. Before we enter our special OPD, I would like to give a brief intro what is Marma and what distinctive treatment we are going to provide. Marma Chikitsa is an ancient Indian practice whose focus is the manipulation of subtle energy, that is prana, in the body. Here, we are going to do prana chikitsa by giving Marma pressure, meditation, and chanting mantra. Headache will be treated by Stapani, Utshepa Marm, Simanta Adhipati Trikatika. Migraine by Stapani, Utshep, Simanta Marm, Adhipati Marm, Trikatika, and Talarhridaya. Stress management by Stapani, Utshep, Shankha, Simanta, Adhipati, and Trikatika Marm. Cervical pain by Amsa, Amsafala, Indrabasti, Shipra, Talarhridaya, Brihati Marm. And Postmenstrual Tension by Tala Hridaya, Katika Taruna, Parsha Sandhi, Nitamba, and Shipramar. I would like to encourage all of you to participate and take benefit of our new Marma OPD. Thank you very much.
अभी उसको ओके क्या फायदा Algo de más. It's okay. Algo de nah, set it. Next. Next. YouTube. Hey, यार YouTube.
Not audible.
Sound that I got. YouTube down कर दीजिए. YouTube down कर. ini saya tambah. Each.
सर आवाज नहीं आ रही वीडियो में आवाज नहीं आ रही सर.
सर इनकन सर आप आपका हिसाब से स्टार्ट कर सकते हैं सर. यहाँ से कुछ सेव हो रहा है सर. From your side सर.
ओके.
यहाँ से कुछ
नहीं, कुछ जगह आ रही है, हो सकता है पर्सनली डॉक्टर साहब का गड़बड़ हो। आई एम हियरिंग।
ओके ओके, ठीक है, इट्स ओके।
उनको नहीं रहेगा, ठीक है।
नहीं, nobody is speaking or no sound is coming. I don't know.
सर
अनिल सुकू, हाँ,
सर
yes, yes.
आवाज आ रहा है सर? हेलो
नहीं, now I am hearing. In the meantime, nobody was speaking or
हेलो
the sound system is there.
हेलो
नहीं, I am hearing your side, sir.
सर वीडियो में आवाज नहीं आ रही है।
उस साइड में स्टार्ट कर सकते हैं सर। यूट्यूब से, यूट्यूब मैंने भेज दिया था, यूट्यूब मैंने भेज दिया था, यूट्यूब का लिंक।
डॉक्टर सचिन जी, ये सर का वीडियो ग्रुप में आप शेयर कर देना, सब लोग देख लेंगे।
नहीं, यूट्यूब का मैंने ये दे दिया था एक्चुअली सर, तो अभी यूट्यूब का वीडियो।
जी सर, ये लिंक हम शेयर कर देंगे सर, जो वीडियो है।
हाँ, ठीक।
अच्छा, जैसे अगर खोले तो अच्छा होता है सर।
सर वो कुछ
सर
ऑडियो नहीं होते
राकेश शर्मा सर के पास था एक्चुअली।
यूट्यूब वीडियो में सर बहुत बार वॉइस नहीं आती है, सिर्फ वीडियो दिखता है, ऐसा होता है।
ओके सर, एनी विश सर।
ये सही है, ये चल रहा था, आवाज भी आ रही थी थोड़ी।
सर यूट्यूब वहां से खुल सकता है सर? हेलो सर, हाँ आपका आ रहा है सर। हाँ सर, वो तो यूट्यूब का ये अगर ये कर देते हैं वो लोग यूट्यूब का, मैंने
जी डॉक्टर अनिल जी।
जी सर, मुझे लगता है कि सचिन जी कार्यक्रम आगे बढ़ाएं, ये लिंक ग्रुप में शेयर कर दीजिएगा।
सर
गुरु जी का स्वागत है, गुरु जी
शर्मा
जुड़े
सर,
हुए हैं सचिन जी।
जी सर, जी सर बोले। जी सर। हाँ हाँ, वो ले फिर इनको हटा दें, बाद में देख लेंगे इनको फिर, या तो।
हाँ, यस, इस समय।
हेलो जी गुरुजी प्रणाम, गुरुजी प्रणाम। आपका आशीर्वचन अपेक्षित है। हमारी प्रेरणा आप हैं सर, तो आपका उद्बोधन आपने पाते ही उनको मिले तो इससे बड़ा अवसर क्या होगा हमारे लिए।
नहीं, जो एक्टिविटीज हो रही हैं शरीर
जी
विभाग की, उनको चलने दीजिए। बाकी मैं
जी।
कोई नई बात थोड़ी कहूंगा।
जी सर, जी सर। पर फिर भी सर, आपसे ही प्रेरणा हमको मिलती है, इसलिए नई बात हो या नहीं, आपकी बात हमारे लिए सर्वप्रधान है सर। जी।
तो आपका जो एक्टिविटी चल रही है वो रुके तब आगे बात करूं।
जी 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 जी। सचिन जी, अपना काम पूरा हो गया सचिन जी?
हाँ जी सर, अभी सर से पहले परमिशन लीजिए, उनका हो गया प्रेजेंटेशन, कुछ बाकी है।
अच्छा अच्छा अच्छा।
नहीं नहीं,
सचिन
आप
जी,
नहीं, जो आप कर
अभी
रहे
बाकी है ना
हैं,
अभी?
जो आप
हाँ, सर का
जो
कंक्लूजन बाकी है।
प्रेजेंटेशन हो,
अच्छा अच्छा अच्छा।
सर आप कंटिन्यू कीजिए सर।
जी जी।
नहीं,
तो
जो प्रेजेंटेशन हो रहा है उससे करिए। डॉक्टर सचिन जी, जो प्रेजेंटेशन हो रहा है दैट इज इम्पोर्टेंट, वो करने दीजिए ना, हमको क्या करना।
जी 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 सर।
हाँ, अभी 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 चल रहा है सर, प्रेजेंटेशन चल रहा है अभी सर,
ओके,
अभी पूरा नहीं हुआ सर।
हाँ तो होने दीजिए,
जी सर,
लेट इट।
हेलो
जी जी सर, जी सर, जी सर।
हेलो,
हाँ हाँ हाँ, जी सर।
प्लीज कंटिन्यू सर।
और
हाँ
वो
सर,
वीडियो
सिकंद जी आवाज आ रही मेरी?
हाँ सर, वो वीडियो का आवाज आ रहा था,
यस
वो जो
सर,
मैंने
अभी
हाँ
आ रहा
हाँ
है।
अभी वाला वीडियो फिर एक बार चालू कर दो, एक मिनट सर।
जी।
Sir, this patient name is actually Sir Shantiram Vaishya. He is coming in the very early part of our mormotherapy. That is when probably he is, I think, 4 or 5 patient. We have registered him. He is an aged patient around the age of probably 58. Then at that time he said that he is very severe pain in the our back. Rest whatever his language is, that's my language, we want to transfer it. He wants to say that after treatment, we have given around 15 days or something, 15 days, and more than the other, we have continued it. Still, we are continuing it, but according to his point of view, he said that he released from the pain and now he able to. Only thing is that we have to continue the mortal. So this is that after we are doing the person get that he not completely, but still he get able to walk. So that is, I think, one kind of our achievement. So these are we have got four or like that our videos. One video that YouTube just we are sending. I think it is not audible or something. Is it audible? Audible? YouTube video. If it is not audible in the laptop, then already I am sending it to our Rakesh Sharma sir, where we are tried. So this is a very recent audio or recent. We can send the link. Send the link also. It's a very recent where we are asked to by our AIMS Guwahati to present in relation with the low back pain, whether any kind of our non-pharmacological intervention is there or not. At that time, I present that, and that is recorded in a video, and that is uploaded in the. So that you can see it later. And finally, I hope that whatever we are going to do, a lot of things has to be done. So mormotherapy enhances the life energy and thereby restoration on circulation in overcoming morbidity. Use of Chikitsa open a wide range of application in cellular and musculoskeletal injury. That is my point of speaking to spec. If we say the Obhigataja only in one particular site, that is only the musculoskeletal injury, I strongly believe that it will also improve our cellular injury, and it is also seen in the different number of our patients. It will definitely broaden the skill of the Ayurvedic practitioner with more quick result. That is, they can give their own therapy, but they can include our mormotherapy along with this. After knowing the proper way of its implementation. So once again, thank you to all of you for giving me an opportunity to share whatever the knowledge that I have got during this whole endeavor of the of 1 hour and of 1 year. And the data that I have presented, these are only from our clinical study. Hence I am totally skipping the other conceptual aspect. Now it is my duty to go to the acknowledgement. I have to definitely acknowledge to your director of Assam, who herself visited my site, principal of our government Ayurvedic college, faculties, all the faculties of the government Ayurvedic college who have sent their patient to a Marma OPD, a new OPD. It is very difficult to start, very difficult to convince someone to send patient. Even then, they have kept faith on us, and seeing the result in our Marma therapy, they have sent it continuously. So it is happy for us to inform you that all the faculties of our government Ayurvedic college help in this aspect, and my PG scholar of my own department has done a tremendous job in this aspect. So, sir, thank you to all of you once again. Thank you, sir.
धन्यवाद सर। अगर किसी को कोई क्वेश्चन पूछना है तो हम सर के साथ हम वो डिस्कस कर सकते हैं।
अमोल जी, अगर हमारे बीच में गुरुजी मौजूद हैं, अगर उनका पाथे अगर पहले हो जाए, शायद उनकी व्यस्तता या शायद उनकी व्यस्तता रहेगी, अगर उनका पाथे हमें पहले मिल जाए तो उसके बाद में हम प्रश्नोत्तर की जो है अगर गुरुजी कहें तो, अगर गुरुजी की आज्ञा हो तो।
हाँ सर।
नहीं, कोई प्रश्न नहीं। बहुत बढ़िया, सभी को बहुत बहुत धन्यवाद। और इतना अच्छा कार्यक्रम संचालन करने के लिए इतने अच्छे श्रोता देश भर में से ढूंढ के, श्रोता और वक्ता दोनों, कई बार कहा जाता ना वक्ता श्रोता से दुर्लभा, अप्रिय सिद्ध सत्य से, लेकिन ये जो सत्य है और प्रिय है,
यस सर,
वास्तव में एनाटॉमी जब से विद्यार्थी पढ़ता है तब से लेकर के और प्रैक्टिस में जाता है तब तक उसको समझता है कि इसकी कोई बहुत उपयोगिता नहीं है, लेकिन एनाटॉमी ये सब्जेक्ट इसलिए पढ़ना है ठीक है। और उस समय मसल्स का ओरिजिन, इंस्ट्रक्शन, बोन्स, ऑस्टियोलॉजी, ये सब कुछ चीज़ें उस आयु में अजीब टाइप की लगती हैं, लेकिन इसके बाद भी जैसे आज हम लोगों ने सोचा और मर्म विज्ञान का कोई उपयोगिता चिकित्सा में है, उससे भी आगे बढ़कर के असम के मेडिकल कॉलेज में, असम के आयुर्वेदिक कॉलेज में मर्म विज्ञान पे ओपीडी प्रारंभ हुई। ये निश्चित रूप से शरीर के काम करने वाले सभी लोगों के लिए एक आश्चर्य मिश्रित अनुभूति है। लेकिन इसके आगे भी मैं कई लोगों को जानता हूं जो डॉक्टर साहब ने विषय रखा, ओंकार, प्राणायाम, इन सब चीज़ों के साथ भी एक आंतरिक मर्म, एक बाह्य मर्म, तो ये सब चीज़ें निश्चित रूप से बहुत ही शीघ्र में प्रकाशन के लिए आना चाहिए, तभी इन सब का काम आगे बढ़ पाएगा। आयोजकों से मेरा एक अनुरोध है कि जैसे ये प्रारंभ हुआ है, ऐसे विभिन्न प्रकार के जो स्पेशलिटीज हैं शरीर की रचना की दृष्टि से, आप सब लोग ज़्यादा जानते हैं, डॉक्टर खेलकर भी हैं, डॉक्टर राकेश शर्मा भी हैं, कम से कम जैसे ये जो विषय निकला मर्म विज्ञान का, तो देश के हर प्रांत से कम एक मर्म विज्ञानी को तलाश करिए। उनकी हो सकता है कि चिंतन की विधाएं अलग अलग होंगी, अभी उनके यहाँ शायद इतना विकसित नहीं हो पाया है मर्म विज्ञान जिससे कि वो वहाँ पे ओपीडी अपनी प्रारंभ कर सकें, लेकिन एक थोड़े लोगों का, 15-20 लोगों का ही एक कार्यक्रम मर्म विज्ञान पे जो लोग काम कर रहे हैं प्रत्येक प्रदेश में नहीं होगा, तो इस माध्यम से जरा सूचना लेकर के उनकी एक पहले ऑनलाइन बैठक करना, फिर अगर आवश्यक होगी तो आप सब लोगों की जो विभिन्न सेमिनार्स होती हैं, मैं एक दूसरे ढंग से बात रखने का प्रयास करूंगा कि उस सेमिनार में एक एक विषय के विशेषज्ञों का एक जगह के सेमिनार हो, उसमें ये जो मर्म विज्ञानी सब उनको प्रयास किया जाए कि इकट्ठे हो जाए, क्योंकि बैठ के ज्ञान को आगे बढ़ाने का रास्ता एक ही है, जिज्ञासा उत्पन्न की जाए और जिज्ञासा की पूर्ति में लोग लगें। उपनिषद काल से भी यही स्थिति रही, परिज्ञान की वृद्धि के लिए परिप्रश्नेन और सेवया, तो प्रश्न के खड़े हों और जो उनके उत्तर देने वाले लोग हैं उनके साथ निकट बैठ के, ये जो उपनिषद कालीन परंपरा रही है, ये ठीक है कि हम लोगों के लिए ये बीच में एक माध्यम सस्ता मिल गया, उसके माध्यम से हम सब लोग इकट्ठा हो जाते हैं। तो ऐसे सब लोगों को एकत्रित करना ये भी एक बड़ा आवश्यक काम है। और मैं समझता हूँ कि विश्व आयुर्वेद परिषद के हम सभी वो कार्यकर्ता हैं। विश्व आयुर्वेद परिषद ने एक ऐसा तो काम कर डाला पूरे देश भर में, जिससे कि अपना संसाधन, अपना समय लगा करके आयुर्वेद के लिए सोचने वाले लोगों की श्रृंखला पूरे देश में खड़ी हो गई। उसको और सुदृढ़ करने की दृष्टि से उनका जो सेक्टर वाइज डिवीजन है उसको करना, और उसका जो क्लिनिकल एस्पेक्ट है जिसके लिए लोग दुखी हैं, क्यों वास्तव में जो आयुर्वेद का लक्ष्य है वो तो पीड़ित मानवता को कष्ट दूर करने के लिए ये विषय सामने आया था। तो हम सब लोग इसमें लगेंगे। मैं समझता हूँ कि आज का ये जो व्याख्यान है और आज का जो प्रकर है वो निश्चित रूप से बहुत ही महत्वपूर्ण बिंदु रहा है, और भविष्य में भी हम सब लोग इसी प्रकार के आयोजनों को करके और उसमें भी और सब डिवीजन करके कि भाई ठीक है, एस्ट्रोलॉजी के कैसे कैसे सब डिवीजन हो सकते हैं, उनके कैसे कैसे लोगों का, विशेषज्ञों की एक बार ऑनलाइन बैठना, फिर जरूरत हो तो ऑफलाइन बैठने की व्यवस्था करना, ये सब लोग करेंगे तो निश्चित रूप से लोगों को लगेगा कि अब से 5 साल के अंदर एनाटॉमी में क्षेत्र में काम करने वाले, शरीर रचना में काम करने वाले जो लोग हैं उनका आयुर्वेद की क्लिनिकल दृष्टि से और ज्ञान के संवर्धन की दृष्टि से जो योगदान है वो आगे बढ़ेगा। ऐसा निवेदन करता हुआ आप सब लोगों ने मेरे विषय को सुना, इसके लिए एक बार पुनः धन्यवाद देता हुआ अपनी बात समाप्त करता हूँ। जय आयुर्वेद, जय भारत।
धन्यवाद गुरुजी, आपके वचन और आपका जो आशीर्वाद हमें प्राप्त हुआ है, इसलिए विश्व आयुर्वेद परिषद रचना शरीर संभाषा टीम की तरफ से मैं आपका आभार व्यक्त करता हूँ। और आपने जो भी हमें मार्गदर्शन दिया और जो भी सुझाव दिए हैं, हम हमारी टीम के साथ बैठकर सर इसके ऊपर में विचार करके तुरंत ही इसमें इम्प्लीमेंटेशन जितना जल्द हो सके करेंगे सर।
गुरुजी, अभी ये कार्यक्रम चल रहा था, इसी बीच में एक पुण्य कार्य और करके आया हूँ गुरुजी। अभी दरअसल क्या हुआ कि कल हमारे देहदान हुआ था और आज उनके बैठक थी, तो उनके यहाँ मैं अभी इसी कार्यक्रम के बीच में वहीं गया था, अभी जस्ट वापस